watching SHEM Ministries, souls honoring Elohim's mandate. And now for today's message.
Well, hello. Welcome to SHEM Ministries. That is Souls Honoring Elohim's Mandate. And tonight is our SHEM 2 night. I am Dr. Anna Shaw Devlin. I am a family nurse practitioner. And this is our medical ministry that God has given us. It is a spiritual, healthy, enlightening mandate ministry. Let me say that again. Spiritually healthy, enlightening mandate ministry, which means that I have been mandated by God to enlighten you through the Spirit of the living God so that you can be healthy for Him to use. You cannot drive across country with a broke down bus, right? You need a vehicle that is, in good shape, right? You wouldn't set out not knowing is the engine good, the, carburetor, all that stuff. Well, guess what? We are vessels, vehicles. We are what God needs to use, and He needs us to be healthy, all right? So that's what I'm here for. And I do appreciate each and every one of you for joining me tonight. If you've seen the header, how about this is part 2 of last week, okay? It's time to talk COVID again, part 2. But tonight we are going to focus more not on medications and, and all that stuff. We're going to focus on being prepared and talk about long COVID. Yep. I want to talk about long COVID because I need you to understand how important it is to try to prevent the spread of COVID. And if you do suspect that you may have COVID, I need you to jump on it, right? Because it's a virus. And as I mentioned to you on last week, there's no cure for a virus. So we're going to kind of extrapolate a little bit more on our talk from last week. And I pray, Lord, in the name of Jesus, help us, Father, to make things plain so that people can understand why are we talking about this again. There's a method to the madness. There is a reason. And I need you to understand. So, Father, bless us on tonight. We first thank you, Lord, for another day's journey. Thank you, oh God. Our heart's desire is to hear you say, well done. So please, Lord, help me to make this plain so that people will understand a virus Understand that just because someone had this or didn't have this, that may not be the case for you. Your immune system, your immunity, your body, how well you take care of yourself, have taken care of yourself, underlying medical issues and problems and things. When we talk about the symptoms of long COVID, I need you to understand that if you already had an issue with this, what the side effects and the long-term side effects can do, the havoc on you. I'm not going to sing tonight. Please don't be disappointed. But to God be the glory. How about Sunday? You might get a little something, something. We'll see. All right. So, I do, though. I have a little screen that I created. I just took the time with an acronym of virus for you to look at, okay, as we talk about long COVID. And I'm not going to leave this up the whole time, but for right now, look at this, okay? V in virus stands for a violent attack. It's a violent attack. It ain't no creep up on you, whatever. It's like, wham, yeah, got you. Okay? Of your immune system. Oh, yeah. Yep. It's a violent attack of your immune system. That's V. That's I. R is, these are kind of harsh words, but in order for you to really, really understand, R stands for robbed and raped. Robbed and raped. Your immune system. Yep, think about that. Ain't no joke, ain't playing. Yes. You is under, S is siege. Now, when something is under siege, it doesn't just like let go. So this long COVID, you may experience the acute symptoms and then they get better. But if your immune system is under siege, it's kind of like a hostage situation where you don't just get out any old kind of way. But let me say this before I go any further. I want to remind you of what I told you on last week. And I am going to hopefully go back and find that one. Bear with me, please, please. If I don't get it right the first time, nope, that is not it. It's this one. There we go. No. What in the world? I'm so sorry. Please, I hope I didn't. Uh-oh. Guess what I did? I deleted the wrong one. Uh-oh. Well, guess what? I ain't worried about it, because guess what? It's up here. It's up here. So last week I talked to you about SHEM 2 and the spiritualness of the ministry. And I said to you, I don't care what topic I don't care what we talk about. Prayer. Because it doesn't have to turn out like the discussion. I am just enlightening you on what things are, how they can be, but I'm saying to you through prayer and supplication, God, have your way. Have your way. And I said to you, pray, keep praying, and pray a little bit more. And I've got some scriptures. I like I said, this is a spiritual thing, and I've got a couple of scriptures here that I want to spend a little bit of time on. I do. Before we talk about this long COVID, let me get rid of that, okay? I want you to go with me to 1 John chapter 5, verses 14 through 15. Yep. Because I need you to understand the significance of praying. And if you don't know exactly what you're praying for, see, I need you to have the facts. I need you to know about long COVID so that you'll know how to pray against it. I need you to know how to pray to shorten you find out you're COVID positive and you start feeling bad. Guess what? You don't have to linger for days. My God is an awesome God, and He can touch you just like that. So I got a couple of scriptures that I want to read and kind of talk a little bit about, okay? So 1 John 5, verses 14 through 15. And this is the confidence that we have in Him, that if we ask anything according to His will, I'm confident that if I ask God and it is according to His will, and He said that He desires for us to be healthy, yes, in good health. So it's according to His will. He heareth us. And if we know that He heareth us, yes, whatsoever we ask, we know that we have the petitions that we desired of Him. I put this petition before you, Lord. I am asking you, and I know you hear me. And I'm asking according to your will. And I'm confident in this, that you will hear me and deliver me. Now, icing on the cake, go with me to Matthew chapter 20. Now, this is where I really want you to focus in your prayer when you do pray. Okay? In Matthew 20, verses 30 through 34, and I'm kind of going to, I'm not going to read it word for word. But there were two blind men, and they heard that Jesus was was going to pass by, right? They heard him pass by. They must have heard all the chatter. Is that Jesus? Is that the Jesus that everybody been talking about? I heard that he can heal people. And, we blind. We can't see. So when they heard that Jesus was passing by, it said they cried out for mercy. And they were rebuked. Like, what you doing calling on Jesus? He ain't got time for you. So even after being rebuked for crying out to God, now listen to this, because this is what I need you to do, because this is what I'm going to do too. They cried the more. I know you didn't rebuke me and tell me I can't call on Jesus. Well, guess what? I'm going to cry even the more. So many times the enemy will attack you and you will, oh, well, maybe I shouldn't do that. The devil is a liar. You better holler, hoop, and holler and call his name even the more, even the louder. Because when you cry out even the more, guess what happened? Guess what happened? They got the attention of Jesus. Jesus said, who is that carrying on like that over there? I guess I better go see what's going on. So they got Jesus' attention. And Jesus stood still. And he specifically asked them, okay, what can I do for them? What you need? Why are y'all carrying on so? Lord, that our eyes may be opened. That's why we carrying on like this. We tired of being blind. We want to be able to see. They were very specific in their prayer. They didn't say, just pray for me. They said, I want my eyes open so that I can see. Yes. And then Jesus did what? He touched their eyes. And didn't say 2, 3, 4, 5 days later. It said immediately they received sight. They received sight immediately. See, the same God yesterday, today, and forevermore, right? I'm telling you, you get over the acute COVID infection. Oh, no. Long COVID, don't you come nigh my dwelling now. I'm going to cry to my God. He going to hear me. I don't care if the devil says, what you crying to him for? You shouldn't have been such and such and you was out there and you got, I don't care. I may have done wrong, but I repent. I did wrong, but my God is going to hear me. Yes, he will. And I'm specifically going to tell him what I need him to do for me. That's right. But guess what happened after they received their sight? They followed him. Now, that is something, that's a sermon by itself, okay? Because so many people, once they get what they want, got what I want, I'm gone now. No, they followed him, okay? So if I'm stepping on your toes or whatever, take it as it is meant to be. Okay? God heals us. He touches us. He restores us. You thought you were going to die. You were so sick. And you recovered. And then you do what? No. You better follow him. That's right. All right. So I just had to mention that as we talk about this long COVID thing. Okay. And you can take this that and apply it to any situation. I don't care what it is. So, what is long COVID? Now, I hate that I deleted the wrong slide, but we're going to put this up, okay? Long COVID is a collection of symptoms that last 3 months or longer after your first COVID symptoms. So, you mean to tell me my fever gone and I'm not positive anymore and there's some stuff that can stay with me? It don't have to. You know how to pray. Okay? But there is something called long COVID. And it can steal your energy, your ability to think clearly, and your sense of smell or taste. Now, the two symptoms of long COVID that, because, go back to last week's lecture when I talked about all the symptoms of COVID, right? But the two things that most people who develop long COVID say that they experience most is the fatigue, all right? So fatigue is no energy. All right. And the other thing is shortness of breath. And I think I've got that on this. Yep, I do. Symptoms can vary. Most common are fatigue and shortness of breath. And I'm not talking about, some people have a chronic cough or have a cough for, a few weeks, but that gets better. I'm talking about being a little winded, shortness of breath where you used to never got short of breath, bending over, putting on your shoes, or you might get a little winded climbing a flight of stairs, a couple flights of stairs, and that's something that is not common for you, but that is a potential. And believe it or not, these symptoms are usually affects anywhere from 5 to 10% of individuals who have had COVID. They're not associated with severity, which means you can have a mild case of COVID and still develop long COVID. I'm not trying to scare you. I'm just trying to give you the facts so you know how to pray. Okay? All right, this is, like I said, this is part 2. But do know that these symptoms can last 12 to 18 months. You joking me? It's a virus. What did I tell you about the virus? Didn't I not say that it's a violent attack and your immune system can be under fatigue for a while? And I'm going to talk to you, we're going to talk a little bit more about the specifics of that attack, okay? In a different way, not the acute symptoms that we talked about on last week. You might feel anxious or depressed. Some people get frequent headaches. And like I said, they may get short of breath, or some people have heart palpitations. And that is due to the attack on your autonomic nervous system. What is an autonomic nervous system? Well, your autonomic nervous system is what you don't have control over. You know, we have voluntary and involuntary movements and control over certain things. Like we can control, slow our breathing down, deep breaths, this, that, and the other. But the heart, blood pressure, those are things that you can't necessarily always. You can do things to kind of slow them down, like hold your breath, bear down, that stimulates the vagus nerve and autonomic regulation and may slow your heart rate down. But for the most part, your autonomic nervous system is something that you do not control. And so some people have palpitations, right? Not because they drank too much caffeine, but it's just something that happens. And there is a syndrome called POTS that I will let me see. I don't want to jump all over the place, but POTS, POTS, is postural orthostatic tachycardia syndrome. I'm sorry, I'm getting ready to explain it. Just think POTS, right? POTS, postural is position. So you can change your position quickly, abruptly. Orthostatic means your blood pressure drops, okay? And when your blood pressure drops, your heart rate goes up to try to compensate for the drop in the blood pressure. And it's something that happens, and it is part of your nervous system and can damage. It can be dysregulated. Remember we talked about dysregulation because of COVID, that virus that's in your body. Viruses do not go away. Okay? They can be dormant. For example, there's two viruses I want to mention. Chickenpox. When you were a child, you may have had chickenpox. And then you got over it and your immune system kind of buried it, right? And then when we get to we develop a kind of an immunity to it in a sense. And then when you get around in your 60s or whatever, stress can cause that virus to come back full force, and we get what's called shingles. Same virus. It's just that we changed the name of it because it's a resurgence of a virus that was dormant in your body. Well, guess what? Any virus can do that. Any virus. And so when we talk about the COVID infection, there are people who had COVID, never really kind of got over it, and they think they got reinfected, but really they did not. It was just a rebound of it, right? And then there are some who it was dormant for a while, but it never went away. And I believe that that's more of what we may say is long COVID. It was suppressed to the point where the symptoms decreased, but they never did go away. Okay? I hate to say it, but that's why I told you. When you find out you're positive, I said pray, 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 pray. Or if you suspect that you may have COVID, pray, 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 pray. You know why? Because there are some people who never seroconvert to being positive. They may have antibodies that may develop later, but their PCR test may never say that they're positive. Okay? I'm just, this is just too much. It's too much. That's why you just got to give it to the Lord. Give it to the Lord. Okay? It's too much. Yep. Because the stress of it is doing what? That's causing havoc on your immune system too. Oh my goodness. Now, I did mention that we were going to say something about being prepared, and that won't take long. So let me just go ahead and talk about being prepared. When I mean being prepared, do you have any COVID tests in your home? A lot of people were smart when they was giving them away for free to go on and get them. Now, many of them may be expired. So I'm not saying don't use an expired test, because expiration dates don't necessarily, it's best by such and such, right? But it doesn't mean that the test may not work. But if the test comes back negative, you may want to get one that's not expired. But if that's all you have, I'm saying use it. Okay? Don't just go throw them away, because I'd rather have something than nothing. So having COVID tests is being prepared. Having Tylenol in your house, okay? To reduce the fever we talked about on last week. So, we get prepared for the storms, hurricanes and tornadoes, whatever, but we don't get prepared for being sick. Saying that, I would always have plenty of water. Never know. Have some water, case of water, whatever, in your home. I tell people to have some orange juice. I mean, not orange juice. Please forgive me. I meant to say apple juice. If you're not allergic to apples, have plenty of apple juice. Not plenty. When I say plenty, I mean like, the 48, 64 ounce. Have at least one or two of them, because someone can bring you some more if necessary. Because what if you get nausea, vomiting, diarrhea? You don't want to get dehydrated, end up needing to go to the hospital and have an IV put in. So have you something that is going to give you some sugar to the brain. And please get the apple juice that doesn't have sugar added to it. Get the real 100% juice, okay? It's worth it. Have some, let me see, what else you gonna need? If you have something for like Pepto-Bismol, nausea, vomiting, diarrhea, just have things that you may anticipate symptoms, that you can treat your symptoms at home. The other thing is underlying medical problems, like you have asthma or COPD. Make sure you have enough of a rescue inhaler, okay? Right? Like Ventolin, Proventil, albuterol, something, right? Even push come to shove, if you don't have that, they still make Primatene Mist. It's over the counter. Something is better than nothing. Your antihistamines, right? Claritin, Allegra. So being prepared means that you have things to treat your symptoms. All right, now, and let go of that, and let's keep going. In regards to the long COVID, let's see what else I want to tell you. I do want to emphasize that I did tell you that long COVID can go on for 3 months or longer. But I want you to understand that it can happen whether you had a mild case or a severe case. The symptoms could be similar to autoimmune, lung, heart, neurological, and psychological disorders, which makes it difficult sometimes to know if you have long COVID or not. Because where did I write that down at? Oh my goodness, hold on. I wrote down some stuff that I wanted to, here it is. All right. So understand that these autonomial, I just had a little brain fog myself. Dysregulation that I talked to you about the autonomic nervous system and everything. Some of these symptoms can be similar to other health problems such as anemia, right? You can feel weak and fatigued because you have anemia. A person who has had blood loss, heavy menstrual bleeding, things such as that, anxiety, underlying anxiety, dehydration from the nausea, the vomiting, electrolyte imbalance, and a person could have a history of heart arrhythmias or just have palpitations. I wanted you to understand that we cannot just ignore certain symptoms and say, oh, that's long COVID. It could be something else. So I wanted to bring that out. Don't, ignore those things as well. All right. And let's see. I think I just got a little out of sync. But guess what? We're going to get back in sync. All right. Yes, here we go. I do apologize. I also want to make sure that you understand that these symptoms can go from mild to severe, wax and wane, and they also can come and go. Remember what I said about the virus in the body. So what if you, after having COVID, was in a stressful situation, or you got exposed to something else, just a regular common cold? And guess what? I hate to say this, but there are people who, especially during flu season, end up with both. Not good. Not good at all. So you don't know which is causing what. So, as I mentioned last week, we have to concentrate on keeping our immune system healthy. Okay? There is no single treatment for this. You treat the symptoms. But they do say that the severity or the potential for developing long COVID can be diminished in people who have been vaccinated. That if you've never been vaccinated and you get COVID, there increase the risk of you being the person that would end up with long COVID. What did I say at the beginning? I'm just giving you facts. I'm just giving you information so you'll know how to pray. That's all. So don't think that I believe or speak that on you. I'm just telling you that those are things that can happen. All right. So let's talk about the brain fog. So trouble thinking or focusing is another thing that I've heard so many people say that how they knew they had long COVID was they had brain fog and they were just like, oh, they were fatigued and they had brain fog. They go back to work. Even though they're over the acute illness, I'm just having such a hard time staying focused. I'm trying to, I know how to do my job, but I'm just struggling. Oh, I feel like a truck ran over me, and long COVID, okay? Even to the point where some people think that they may have been reinfected. But remember what I said. Not necessarily reinfection, but that dormancy, it dwindled, but it's still present. Okay? The headaches, I told you could develop a chronic cough, difficulty sleeping or insomnia, worsening anxiety and depression, that can occur as well. I do want to now talk about something that I have not talked about tonight, but I want to talk about inflammation. Because inflammation can cause all sorts of issues, especially if you're someone who has some inflammation already, like arthritis is an inflammatory response, okay? It's inflammation. So your immune system, because of the COVID, will react and try to get rid of it. It will try to fight it. It will battle it. And in the process of the battle, you know how you get a swole lip, a black eye. That's from inflammation from the blows you received when somebody punched you in the face, right? Guess what? Your immune system gets beat up too. So instead of a swollen lip or a your cheekbone, your jaw swollen, you know, how about you get this inflammation in your body, in your tissues, yeah. So this inflammatory process or this inflammation causes in your organs and your tissues can keep going on and on for a while. So is that why my muscles are feeling so weak and fatigued and tired? Could be. That inflammation. The battle is still going on. It's just on the inside and you can't see it. But how long, if someone punched you in the mouth and your lip is swole, the pain and the tenderness is not going to go away until the swelling goes down. Well, if there's the battle still going on the inside of you, you get it? Okay, I think so. I think you're really, really smart and you got it. Okay, so understand the inflammation may take a while to go down. So I wanted you to understand why some of those symptoms may still be present. There is also a viral persistence that the COVID virus itself might hang around in your body long after you feel better. We already said that. And I did mention that you can test negative for COVID and you're not contagious anymore, but it could continue to cause issues in your body. I wanted to mention that again, and that is called viral persistence. Still there, okay? Now let's talk about reactivation of other viruses. Now this is something new that we haven't talked about. So, well, we kind of talked about the chickenpox and we talked about shingles and chickenpox, right? But there are other viruses that remain inactive or dormant in our body. For example, what if when you were young, you got mononucleosis? I remember that. They used to call that the kissing disease. Okay. Well, what if you had mono back in the day, which is an Epstein-Barr virus? What did I tell you about viruses? They do not go away. They still be there. They went to sleep. But what if the not vaccination, but the COVID infection woke up the Epstein-Barr virus? OMG. Or woke up chickenpox or shingles. Are you telling me that some of my long COVID could be reactivation of other viruses that were lying dormant in my body, in my immune system? It's a possibility, okay? Pray, 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 okay? There's also part of the long COVID, long-term psychological effects of having a serious illness, especially if you had a severe case of COVID and had to be hospitalized. There's anxiety, depression. What if you had to be intubated on a ventilator? There's a lot associated with that. The mental health, just the distress, the mental health distress can linger for a while. We talk about post-traumatic stress disorder. Well, guess what? All right. Just giving you knowledge and telling you what you need to know so you'll know how to pray. I already told you that your risk factors are higher if you have not been vaccinated. I told you that health conditions such as obesity, lung disease, right? COPD, emphysema, diabetes and high blood pressure put you at risk because you've already have something going on in your body that is a battle. The more battles you're fighting at once, just trying to keep your blood sugar regulated, the more battles, the more stress on your immune system. You don't realize it, but it's a battle. So if your nervous system, the autonomic nervous system is working hard, trying to lower your blood pressure, and your kidneys are doing this, that, and the other, you're trying to, listen, I'm trying to tell you, everything in our body is essentially linked together. There's no separation. Eventually, they're going to cross paths. Okay, so understand that. Well, how do I know I got long COVID? Well, you go talk to your doctor and they go through a series of questions. They may do some tests to rule stuff out, right? They may do, remember when I said about anemia? They may do a CBC on you just to see where make sure it's not your hemoglobin. Make sure that your white blood cell count is not elevated. Maybe that cough, maybe you developed a pneumonia. Do you remember when COVID first came out? It was mostly respiratory and people were developed COVID pneumonia. Okay, still possible. Yes, it is. Okay, so you may get a chest x-ray, right? Your weakness, the brain fog, some of those things could be stroke-like symptoms. And they may decide to do, especially if you're high risk, they may decide to do a CT of the chest, CT of the brain. What if it's a blood clot? You can't breathe. There's so many things that can be done. All right. And of course, an EKG, especially if you're having palpitations or feel your heart fluttering, because you could be in atrial fibrillation or some type of arrhythmia. Okay. Now, I'm not even going to mention medications, because the only medications that you treat symptoms, and they do say that a person who has never been vaccinated, we talked about the risk versus the benefit of taking Paxlovid and the other antiretrovirals. Risk versus benefit. I've never been vaccinated. I got COVID. I would lean toward getting the Paxlovid, okay? Just because the risk that I have for having long COVID. Yep. And do know that this Paxlovid should be started within the first 5 days. The sooner the better. 3 days would be ideal. Okay? All right, just saying. And remember what I told you on last week, that you can go to the pharmacist and you do not have to actually be positive. You have the symptoms. Now, one thing that they are doing for people who have lost their taste and their smell, there is a nerve block. And I should have put it on a slide, but I didn't. But it's called stellate ganglion block. Stellate, stellate ganglion block. It numbs certain nerves in your neck that can affect your sense of smell. So we're talking very severe case where you need to be able to smell smoke, right? Something's burning. Certain things you gotta smell. And for people who, I'm not talking about diminished smell, I'm talking about can't smell. All right? So that would be something you would want to consider. The stellate ganglion block. There's also olfactory retraining. So your olfactory nerve also for smell. And what they do is they retrain, they use common smells, and they try to retrain your brain to help your brain remember what things should smell like. I'm telling you. Physical therapy, the weakness, the fatigue, pulmonary rehab, special in counseling, the anxiety, the depression. There's a lot potential things that can be done to combat your symptoms. I do want to say, though, that there's no single way to prevent long COVID. But as I mentioned, vaccination, avoiding infection are the two things that are most beneficial. We talked about good hand washing, wearing, a N95 or a KN95 mask. Why KN or N95? Because they have been tested to prevent the particles from the material that the mask is made of has been tested and received approval. Okay, and remember, do not get these other masks that profess such a thing. All right. Let me see what else I wanted to... I want to make this statement here about the neurological impact. I got to tell you about this real quick. There was a study. Oh, and I do apologize. Please forgive me. My information came from the Cleveland Clinic and from Medscape. Okay, I do try to tell you where my information is evidence based, and I do study and back it up. Now, I'm going to talk to you about a research study that was done about the neurological impacts of long COVID. Nervous system, neurological, okay? Whew. Because of the fact that the neurological symptoms of long COVID are vast, there's so many, they're common, hard to treat, they're disabling, and they can mimic dozens of other syndromes, right? How about the Yale School of Medicine and the director of the Yale Neuro-COVID Clinic? Can you believe they have a neuro-COVID clinic in New Haven, Connecticut, in the Yale School of Medicine, specifically for long COVID and the neurological impact? It is that potentially severe and detrimental. 12 to 18 months. Yeah. A clinic devoted to the research and treatment of these neurological side effects. Wow. That is something to really think about. I'm not joking with you about this. It does exist. And as I mentioned about autonomic nervous system, this article was July 17th. Just came out not long ago. And it says that the recent evidence suggested long COVID is primarily an autonomic nervous system disorder, which means if I don't have control over my autonomic nervous system, so you're telling me I don't have much control over long COVID. That's exactly what I'm saying. This is what they are suspecting after current, more recent research. Remember what I told you about research. It's ongoing, and it takes a while to truly study something and draw conclusions. The hypothesis, all of this. If you've never done, and most people in their science class, the teacher made you do some type of research study where you had to come up with a hypothesis and then you had to prove it and all of that. You did the research, you did the testing and all of that. So it takes time. But this is what they're saying as of now, that it's an autonomic disorder. They are also trying to identify small vessel disease dysfunction. And that's one of the reasons why when COVID first came out, there were so many people having strokes. Okay? Because of the vascular inflammation. Remember what I said about inflammation? But inflammation that is vascular, the blood vessels, impacts the blood vessels. And that is, it has to do with the endothelial lining of our blood vessels. And I don't know if you remember when we talked about the development of coronary artery disease and atherosclerosis and plaque formation. And I told you that it wasn't so much as the plaque itself, the cholesterol. It was the endothelial damage of the lining of the blood vessel, that the inflammation in that endothelial layer. Well, guess what? That is where the virus, they're identifying that vascular inflammation that can occur is in that endothelial layer, increasing the potential for platelet dysfunction, and you end up forming a clot, and the clot causing you to have a stroke or vascular disease, where a DVT, a blood clot in the leg, or a clot in the heart, blockage, ischemia, the brain. Okay? Understand that this long COVID is strongly linked to vascular inflammation that can precipitate other diseases, other acute events. All right. So I wanted you to know that. I wanted you to know that despite all of these risks, all this potential of dysfunction in our body, right? God is able. He immediately opened the blind man's eyes. Immediately. Cry, and cry louder in your prayer. Because I'm going to tell you, the way things are, we don't know. We don't know tomorrow. There's nothing that we can predict. Even the weatherman. It's so funny now how you have to actually pull up the weather report like 2-3 times a day to really get a good, clear indication as to what the weather's going to be like, because it keeps changing. They may say, well, we think tomorrow, next blah, 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 it's going to be sunny. And then tomorrow's prediction will say, no, it's going to be partly cloudy, blah, 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 right? No one knows. But one thing we can do, send up your timber while you have chance. While it is still day, right? Father, we thank you and we praise you that there's nothing that can happen to us that you cannot fix, that you will see us through, Lord. This conversation is informational, okay? Informational. I just need you to know what potentially can exist. To know that symptoms can linger for a long time. And the reason it's so hard and difficult is because of our other comorbid potential situations. So my suggestion to everyone, pray for your immunity, your immune system. You want a strong immune system. Yeah, you do. And do I need to say again how we get that strong, or what the research says about, and I do believe the microbiomes. I do. I really do. And the reason I do, and it's not because I researched it and studied it, The reason I do is because I have tried it. I have been taking probiotics for years, and I can tell a big difference. And I'm not going to say that I haven't been under stress. And I can get sick tomorrow. I'm not saying that I'm immune to illness. But I'm saying that in the grand scheme of things, that the number of colds or the number of, has decreased in number, right? And I do tell God, thank you. I do. Thank you for your love and your protection, Lord. And thank you for guidance and wisdom and knowledge and understanding. Okay? But most of us, like I said, the good analogy that I can make in regards to long COVID is to think about when we had the varicella chickenpox virus as a child. And those people who ended up with shingles, they will tell you shingles was X times worse than the chickenpox. Okay? So when something is dormant for a long period of time, many times they chilling, they getting fat, they eating, and they just having them a good time, right? And then when they come back with a vengeance. Okay, so I do pray those of you viewers tonight who either have had, recently had, know someone that has had, share this information with others and do your due diligence to take care of yourself and protect yourself. All right. Well, God bless you. Thank you for tuning in. This is Dr. Anna Shaw Devlin, family nurse practitioner. SHEM 2 and Ask Anna. God bless. All right. We will see you on Sunday. To God be the glory. Have a blessed, restful night's sleep.